In vitro fertilization, IVF, protocols, indications, and success rates. In vitro fertilization, IVF, is one of the most widely used and successful assisted reproductive technologies, ART, that helps couples with infertility problems. IVF involves the fertilization of an egg with sperm outside the body, followed by the transfer of the resulting embryo S into the uterus for implantation. IVF is recommended when other fertility treatments have failed or when certain infertility factors are present. 1. IVF protocols. IVF protocols are carefully tailored to each individual based on factors like age, ovarian reserve, and underlying infertility issues. The protocol involves several stages, each with specific medications and monitoring requirements. A. Ovarian stimulation. The first step in IVF is stimulating the ovaries to produce multiple eggs, oocytes. Normally, only one egg is released during a menstrual cycle, but IVF requires multiple eggs to increase the chance of successful fertilization. Medications. Gonadotropins, FSH and LH, are injected to stimulate the ovaries to produce multiple follicles. In some cases, GnRH agonists or antagonists are used to prevent premature ovulation. Monitoring. Blood tests and ultrasounds are used to monitor hormone levels and follicular growth. The goal is to have 8 to 15 follicles of appropriate size. B. Triggering ovulation. Once the follicles are sufficiently developed, the next step is to trigger ovulation. This is done by administering an injection of human chorionic gonadotropin, HCG, which mimics the natural LH surge and induces final egg maturation. Timing. The timing of this injection is crucial to ensure eggs are retrieved at the optimal time. C. Egg retrieval, aspiration. Approximately 36 hours after the HCG injection, the eggs are retrieved in a minor surgical procedure known as egg retrieval or aspiration. This is done under sedation or local anesthesia, and a thin needle is inserted through the vaginal wall to collect the eggs from the ovaries. Monitoring. The procedure is carefully monitored via ultrasound to guide the needle into the ovaries. Success. On average, 10 to 15 eggs are retrieved, but the number can vary. D. Sperm collection and preparation. On the same day as the egg retrieval, the male partner provides a sperm sample, which is processed and prepared in the laboratory to isolate the healthiest sperm. In cases of male infertility, sperm may be retrieved via surgical sperm retrieval methods, e.g. TESE or PESA. Sperm selection. The best quality sperm is selected for fertilization. E. Fertilization. The eggs and sperm are combined in the laboratory dish. Fertilization can occur in two ways. Conventional IVF. Eggs and sperm are mixed together and fertilization occurs naturally. Intracytoplasmic sperm injection, ICSI. A single sperm is injected directly into an egg. This method is often used in cases of male infertility, e.g. low sperm count or poor motility. F. Embryo culture. After fertilization, the embryos are cultured for 3 to 5 days, depending on their development. The embryos are monitored for cell division and quality. The best quality embryos are selected for transfer. Blastocyst stage. In some cases, embryos are cultured until they reach the blastocyst stage, day 5, which increases the chance of successful implantation. G. Embryo transfer. The final step in IVF is transferring one or more embryos into the uterus. This is a non-invasive procedure in which a catheter is used to place the embryos into the uterine cavity. Embryo selection. The number of embryos to be transferred depends on the woman's age, the quality of the embryos, and other factors. In general, 1 or 2 embryos are transferred to reduce the risk of multiple pregnancies. Success. The procedure is painless and done under ultrasound guidance. 2. Indications for IVF. IVF is recommended for couples who face certain fertility challenges, including both male and female factors. Some of the primary indications for IVF include A. Female infertility factors, blocked or damaged fallopian tubes. IVF bypasses the fallopian tubes, which are necessary for the natural fertilization process. Endometriosis. Severe endometriosis can cause damage to the ovaries and fallopian tubes, affecting fertility. IVF can help by bypassing the tubal issue and using the eggs directly. Diminished ovarian reserve. Women with a low number of healthy eggs may be advised to try IVF. In such cases, egg donors may be used. Polycystic ovary syndrome, PCOS. Women with PCOS may not ovulate regularly, and IVF can help regulate ovulation and achieve pregnancy. Advanced maternal age. As women age, the quality and quantity of their eggs decline. IVF may be used to optimize pregnancy chances for older women. Uterine abnormalities. IVF can bypass structural uterine issues, such as fibroids or polyps that might interfere with pregnancy. B. Male infertility factors. Low sperm count, oligospermia. IVF with ICSI is often used to inject a single sperm directly into an egg. Poor sperm motility, asthenozoospermia. IVF with ICS helps overcome poor sperm motility by directly fertilizing the egg. Sperm morphology issues, teratozospermia. IVF with ICSI is effective in cases of sperm with abnormal shape or morphology. Azoospermia, no sperm. Sperm can be retrieved through surgical methods, TESE or PISA, for IVF with ICSI. C. Unexplained infertility. When no clear cause for infertility is found after testing, IVF may be recommended as a more advanced solution to improve the chances of conception. 3. Success rates of IVF. Success rates of IVF can vary significantly based on several factors, including the woman's age, the quality of eggs and sperm, and the reason for infertility. A. Age-related success rates. Under 35, IVF success rates are approximately 40 to 50% per cycle. 35 to 37, success rates decrease to 30 to 40% per cycle. 38 to 40, success rates decrease further to 20 to 30% per cycle. Over 40, success rates drop to 10 to 15% per cycle, and the chances of a successful pregnancy are further reduced with age, especially if the woman's own eggs are used. B. Factors affecting IVF success. Ovarian reserve, the number and quality of a woman's eggs significantly influence IVF outcomes. Women with a higher number of healthy eggs tend to have better success rates. Embryo quality. Higher quality embryos have a greater chance of implantation and pregnancy. Male factor. The quality of sperm can impact fertilization rates. ICSI can help overcome male infertility issues. Lifestyle factors. A healthy lifestyle, including a balanced diet, moderate exercise, and stress management, can positively influence IVF outcomes. Clinic expertise. The experience and success rates of the fertility clinic performing IVF are crucial factors in success. 4. Conclusion. IVF is a highly effective and widely used treatment for infertility, with protocols that have been refined over decades. While the process can be complex and emotionally taxing, IVF offers many couples their best chance of having a biological child, especially in the face of challenging infertility factors. Advances in egg freezing, embryo freezing, and genetic testing continue to improve IVF success rates. Though age and reproductive health significantly impact success, IVF remains a powerful tool for overcoming infertility challenges and achieving pregnancy.